Post-traumatic stress disorder, PTSD, differs from acute stress disorder in that a. Acute stress disorder occurs earlier than PTSD. b. PTSD is associated with at least 3 dissociative symptoms. c. Re-experiencing the trauma is not found in acute stress disorder. d. Avoidance of stimuli associated with the trauma is only found in PTSD. e. PTSD lasts less than 1 month after a trauma. The answer is A. Acute stress disorder occurs earlier than PTSD and remits within 2 days to 1 month after a trauma, not PTSD. It is characterized by re-experiencing, avoidance, and increased arousal. Symptoms of increased arousal include insomnia, irritability, hypervigilance, and exaggerated startle. The risk of developing anxiety disorders is enhanced by A. Eating disorders, b. Depression, c. Substance abuse, d. Allergies, e. All of the above. The answer is E. Anxiety disorders may comprise risk factors for the development of some cardiovascular and neurological diseases, such as ischemic heart disease and migraine. There is an association between anxiety disorders and allergies, high fever, immunological diseases and infections, epilepsy, and connective tissue diseases. Which of the following is not a sign of poor prognosis in obsessive-compulsive disorder, OCD? A. Childhood onset. B. Coexisting major depression. C. Good social adjustment. D. Bizarre compulsions. E. Delusional beliefs. The answer is C. A good prognosis for people with obsessive-compulsive disorder, OCD, is indicated by good social and occupational adjustment, the presence of a precipitating event, and an episodic nature of symptoms. About 1/3 of patients with OCD have major depressive disorder, and suicide is a risk. Which of the following statements regarding anxiety and gender differences is true? A. Women have greater rates of almost all anxiety disorders. B. Gender ratios are nearly equal with OCD. C. No significant difference exists in average age of anxiety onset. D. Women have a 2-fold greater lifetime rate of agoraphobia than men. E. All of the above. The answer is E. Community studies show that women have greater rates of almost all of the anxiety disorders. Women have an approximately 2-fold elevation in lifetime rates of panic, generalized anxiety disorder, agoraphobia, and simple phobia compared with men. Girls tend to have more of all subtypes of anxiety disorders irrespective of the age composition of the sample. Which of the following epidemiological statements is true regarding anxiety disorders? A. Panic disorder has the lowest heritability. B. The mean age of onset is higher in girls. C. The age of onset is earlier than that of mood disorders. D. Rates in males peak in the 4th and 5th decades of life. The answer is C. Anxiety disorders have the earliest onset of all major classes of mental and behavioral disorders with a median onset by the age of 12 years. Women have greater rates of anxiety disorders than men. Panic disorder has the highest heritability and has been shown to have the strongest degree of familial aggregation. Sigmund Freud postulated that the defense mechanisms necessary in phobias are A. Regression, condensation, and dissociation. B. Regression, condensation, and projection. C. Regression, repression, and isolation. D. Repression, displacement, and avoidance. E. Repression, projection, and displacement. The answer is D. Freud viewed phobias as resulting from conflicts centered on an unresolved childhood Oedipal situation. In adults, the sexual drive continues to have a strong incestuous coloring, and arousal tends to create anxiety that is characteristically a fear of castration. The anxiety then alerts the ego to exert repression to keep the drive away from conscious representation and discharge. Anxiety disorders are greater among people at lower socioeconomic levels. B. Are highest among those with higher levels of education. C. Are lowest among homemakers. D. Have shown different prevalences with regard to social class but not ethnicity. E. All of the above. The answer is E. Anxiety disorders are negatively associated with income and education levels. There is almost a twofold difference between rates of anxiety disorders in individuals in the highest income bracket and those in the lowest. Anxiety disorders are higher in homemakers and those who are unemployed or have a disability. Generalized anxiety disorder is least likely to coexist with another mental disorder. B. Has a female-to-male ratio of 1 to 2. C. Is a mild condition. D. Has about a 50% chance of a recurrence after recovery. E. Has a low prevalence in primary care settings. The answer is D. Generalized anxiety disorder, GAD, is a chronic, not mild, condition, and nearly half of patients who eventually recover experience a later recurrence. GAD is characterized by frequent, persistent worry and anxiety that is disproportionate to the events or circumstances on which the worry focuses. Physiological activity associated with PTSD include all, except A. Decreased parasympathetic tone. B. Elevated baseline heart rate. C. Excessive sweating. D. Increased circulating thioxin. E. Increased blood pressure. The answer is D. Evidence suggests that post-traumatic stress disorder, PTSD, is associated with elevated baseline heart rate, increased blood pressure and excessive sweating. Preliminary evidence suggests that this autonomic imbalance can be normalized with selective serotonin reuptake inhibitor treatment. There is no change in blood level of thioxin in those with PTSD. Unexpected panic attacks are required for the diagnosis of A. Generalized anxiety disorder. B. Panic disorder. C. Social phobia. D. Specific phobia. E. All of the above. The answer is B. The clinician must consider the context of the panic attack when making a diagnosis of panic disorder. Panic attacks can be divided into two types. 1. Unexpected panic attacks, which are not associated with a situational trigger. And 2. Situationally bound panic attacks. Isolated panic attacks without functional disturbances. A. Usually involves anticipatory anxiety or are phobic. B. Are part of the criteria for diagnostic panic disorder. C. Occur in less than 2% of the population. D. Rarely involve avoidance. E. None of the above. The answer is A. In the DSM-4, there is no longer a specific number of panic attacks necessary for panic disorder diagnosis. Rather, recurrent panic attacks must be recurrent and must be followed by 1 month of anticipatory anxiety, or phobic avoidance. Isolated panic attacks without functional disturbances are not diagnosed as panic disorder. Which of the following is not a component of the DSM-4 diagnostic criteria for OCD? A. Children need not recognize that their obsessions are unreasonable. B. Obsessions are acknowledged as excessive or unreasonable. C. Obsessions or compulsions are time-consuming and take more than 1 hour a day. D. The person recognized the obsessional thoughts as a product of outside him or herself. E. The person attempts to ignore or suppress compulsive thoughts or impulses. The answer is D. An individual must exhibit either obsessions or compulsions to meet DSM-4 criteria. Obsessions are persistent ideas, thoughts, impulses, or images that are experienced as intrusive and inappropriate, causing distress. Compulsions are time-consuming and associated with efforts to either ignore or suppress the obsessions. All of the following are true for the course of panic disorder except A. Patients become concerned after the first 1 or 2 panic attacks. B. Excessive caffeine intake can exacerbate symptoms. C. Comorbid depression increases risk for committing suicide. D. The overall course is variable. E. Patients without comorbid agoraphobia have a higher recovery rate. The answer is A. After 1 or 2 panic attacks, patients may be relatively unconcerned about their condition. With repeated attacks, however, the symptoms may become a major concern. Excessive intake of caffeine or nicotine can exacerbate the symptoms. Depression can complicate the symptom picture in 40 to 80% of all patients. Tourette's disorder has been shown to possibly have a familial and genetic relationship with A. Generalized anxiety disorder. B. Obsessive-compulsive disorder. C. Panic disorder. D. Social phobia. E. None of the above. The answer is B. Tourette's disorder and certain types of motor tic syndromes, OCD and chronic motor tics, may have a genetic or familial role in some cases of OCD. Because there is considerable evidence of a genetic contribution to Tourette's, this finding also supports a genetic role in a subset of cases of obsessive-compulsive disorder. All of the following have been noted through brain imaging in patients with panic disorder, except A. Magnetic resonance imaging, MRI, studies have shown pathological involvement of both temporal lobes. B. Generalized cerebral vasoconstriction. C. Right temporal cortical atrophy. D. Increased blood flow to the basal ganglia. E. Positron emission tomography scans have implicated dysregulation of blood flow in panic disorder. The answer is D. Anxiety disorders and panic attacks are associated with cerebral vasoconstriction, which may result in central nervous system symptoms such as dizziness and in some cases hyperventilation and hypercapnia. Increased blood flow to the basal ganglia has not been noted in patients with panic disorder. A patient with OCD might exhibit all of the following brain imaging findings except A. Longer mean T1 relaxation times in the frontal cortex than normal control subjects. B. Significantly more gray matter and less white matter than normal control subjects. C. Abnormalities in the frontal lobes, cingulum, and basal ganglia. D. Decreased caudate volumes bilaterally compared with normal control subjects. E. Lower metabolic rates in basal ganglia and white matter than in normal control subjects. The answer is E. Brain imaging studies of patients with OCD using PET scans have found abnormalities in frontal lobes, cingulum, and basal ganglia. Volumetric computed tomography scans have shown decreased caudate volumes bilaterally in OCD patients, compared with normal control subjects. Morphometric MRI has revealed that OCD patients have significantly more gray matter and less white matter. Buspirone, Buspir, acts as a dopamine partial agonist useful in the treatment of OCD. B. Serotonin partial agonist useful in the treatment of OCD. C. Dopamine partial agonist useful in the treatment of generalized anxiety disorder. D. Serotonin partial agonist useful in treatment of generalized anxiety disorder. E. None of the above. The answer is D. Biosprone, Biospa, is a serotonin receptor partial agonist and is most likely effective in 60 to 80% of patients with GAD. The major disadvantage of biosprone is that its effects take 2 to 3 weeks to become evident, compared to the almost immediate anxiolytic effects of the benzodiazepines. Which of the following choices most accurately describes the role of serotonin in OCD? A. Serotonergic drugs are an ineffective treatment. B. Dysregulation of serotonin is involved in the symptom formation. C. Measures of platelet binding sites of titrated imipramine are abnormally low. D. Measures of serotonin metabolites in cerebrospinal fluid are abnormally high. E. None of the above. The answer is B. Serotonergic drugs are an effective treatment, but it is unclear whether serotonin is involved in the cause of OCD. Measures of platelet binding sites of imipramine and of serotonin metabolites in cerebrospinal fluid are variable, neither consistently abnormally low nor abnormally high. Which of the following medical disorders are not associated with panic disorder due to a general medical condition? A. Cardiomyopathy. B. Parkinson's disease. C. Epilepsy. D. Sjogren's syndrome. E. Chronic obstructive pulmonary disease, COPD. The answer is D. The symptoms of anxiety disorder caused by a general medical condition can be identical to those of the primary anxiety disorders. A syndrome similar to panic disorder is the most common clinical picture. Other medical disorders associated with panic disorder include chronic pain, primary biliary cirrhosis and epilepsy. Which of the following disorders is rarely confused with anxiety, that stems primarily from medical disorders? A. Panic disorder. B. Specific phobia. C. Obsessive-compulsive disorder. D. Post-traumatic stress disorder. E. Generalized anxiety disorder. The answer is B. Panic attacks are associated with a variety of endocrinologic disorders, including hypo and hyperthyroid states, hyperparathyroidism, and pheochromocytoma. Episodic hypoglycemia associated with insulinomas can also produce panic-like states. These include seizure disorders, neoplasms, and the effects of both prescribed and illicit substances on the central nervous system. Induction of panic attacks in patients with panic disorder can occur with A. Carbon dioxide. B. Cholecystokinin. C. Daxapram. D. Yohimbian. E. All of the above. The answer is E. Many substances have shown similar panicogenic properties, including the noradrenergic stimulant yohimbian, yocan, and carbon dioxide. Panic disorder appears to be caused by genetic predisposition and some type of traumatic distress. Patients with panic disorder have abnormally brisk cerebrovascular responses to stress. First-line medication treatments of anxiety disorders may generally include all of the following except A. Diazepam, Valium. B. Fluoxetine, Prozac. C. Fluvoxamine, Luvox. D. Nefazodone, Certone. E. Venlafaxine, Effexa. The answer is A. Antidepressants have become first-line recommendations for panic disorder, social phobia, OCD, and PTSD. Evidence now exists that such medications are also effective for generalized anxiety disorder. SSRIs such as fluoxetine, Prozac, and sertraline, Zoloft, are probably more effective than benzodiazepines. Therapy for phobias may include all of the following except A. Counterphobic attitudes. B. Flooding. C. Phenelzine, Nardil. D. Propranolol, Inderal. E. Systematic desensitization. The answer is A. Many activities may mask phobic anxiety, which can be hidden behind attitudes and behavior patterns that represent a denial of the dreaded object or situation. A counterphobic attitude is not a therapy for phobias, although it may lead to counterphobia behavior. Mr. A was a successful businessman who presented for treatment after a change in his business schedule. Although he had formerly worked largely from an office near his home, a promotion led to a schedule of frequent out-of-town meetings requiring weekly flights. Mr. A reported being deathly afraid of flying. Even the thought of getting on an airplane led to thoughts of impending doom, in which he envisioned his airplane crashing to the ground. These thoughts were associated with intense fear, palpitations, sweating, clamminess, and stomach upset. Although the thought of flying was terrifying enough, Mr. A became nearly incapacitated when he went to the airport. Immediately before boarding, Mr. A would often have to turn back from the plane, running to the bathroom to vomit. Which of the following is the most appropriate treatment for this patient who has another flight scheduled tomorrow? A. Beta agonists. B. Exposure therapy. C. Lorazepam. D. Paroxetine. E. None of the above. The answer is C. Benzodiazepines, such as lorazepam, Ativan, are the most appropriate choice of treatment given their high safety margin, for example, in overdose. Paroxetine, an SSRI, is not indicated for the immediate treatment of phobias. The most commonly used treatment for specific phobia is exposure therapy. Ms. K described a long history of checking rituals that had caused her to lose several jobs and had damaged numerous relationships. She reported that her obsessions about security had become so extreme over the past 3 months that she had lost her job. Ms. K recognized the irrational nature of her obsessive concerns but could not bring herself to ignore them. Which of the following symptom patterns of OCD does Mrs. K present? A. Intrusive thoughts. B. Symmetry. C. Pathological doubt. D. Contamination. E. None of the above. The answer is C. In this case, Mrs. K presents the symptom pattern of pathological doubt followed by a compulsion of checking. The patients have an obsessional self-doubt and always feel guilty about having forgotten or committed something. Patients with OCD can literally take hours to eat a meal or shave their faces. A 23-year-old woman presents to clinic with a chief complaint of difficulty concentrating because I worry about my child. She had recently gone back to teaching after having her 3rd child. The patient states she is constantly wondering about other things as well. For example, she is going to help her sister-in-law throw a goodbye party, and finds herself constantly going over what she needs to do to prepare for the party. At the end of the day, her husband claims she is irritable and tired. At night, she is unable to sleep and keeps thinking about her tasks for the next day. What is the most likely diagnosis? A. Avoidant personality disorder. B. Obsessive-compulsive disorder. C. Obsessive-compulsive personality disorder. D. Generalized anxiety disorder. E. None of the above. The answer is D. Excessive and uncontrollable worry characterized by irritability, insomnia, and fatigue is the most likely attributable to generalized anxiety disorder. Patients with avoidant personality disorder have a long-standing pattern of avoiding activities because they fear judgment. Obsessive-compulsive personality disorder often seek perfection and organization to a degree that it causes functional impairment. Directions. Each set of lettered headings below is followed by a list of numbered words or phrases. For each numbered word or phrase, select A. If the item is associated with social phobia only. B. If the item is associated with agoraphobia only. C. If the item is associated with both social phobia and agoraphobia. D. If the item is associated with neither social phobia nor agoraphobia. Symptoms include blushing and muscle twitching. The answer is A. Associated with social phobia only. Is associated with a sense of suffocation. The answer is B. Associated with agoraphobia only. May be associated with panic attacks. The answer is C. Associated with both social phobia and agoraphobia. Patients are comforted by the presence of another person. The answer is B. Associated with agoraphobia only. Social phobia is the excessive fear of humiliation or embarrassment in various social settings, such as speaking in public or urinating in a public restroom. It can sometimes be difficult to differentiate from agoraphobia, which is the fear of or anxiety regarding places from which escape may be difficult. Directions. Each set of lettered headings below is followed by a list of numbered words or phrases. For each numbered word or phrase, select A. If the item is associated with generalized anxiety disorder only. B. If the item is associated with panic disorder only. C. If the item is associated with both generalized anxiety disorder and panic disorder. D. If the item is associated with neither generalized anxiety disorder nor panic disorder. Response rates between 60 and 80% have been reported to bios-prone. The answer is A. Associated with generalized anxiety disorder only. Patients with the disorder may still be responsive to bios-prone after being exposed to benzodiazepines. The answer is A. Associated with generalized anxiety disorder only. Biosprone's use is limited to potentiating the effects of other antidepressants, and counteracting the adverse sexual effects of selective serotonin reuptake inhibitors. The answer is D. Associated with neither generalized anxiety disorder and panic disorder. Relapse rates are generally high after discontinuation of medication. The answer is C. Associated with both generalized anxiety disorder and panic disorder. Tricyclic drugs have been reported to worsen anxiety symptoms in patients, in whom the first symptoms were precipitated by cocaine. The answer is B. Associated with panic disorder only. Biosprone was promoted as a less sedating alternative to benzodiazepines in the treatment of panic disorder. Biosprone does not alter cognitive or psychomotor function, does not interact with alcohol, and is not a muscle relaxant or an anticonvulsant. Cocaine-induced panic attacks may be related to a kindling-like phenomenon. Medication taper should be slow, with careful monitoring of symptoms. Biosprone is a potential alternative to benzodiazepines treatment in GAD as an anti-anxiety treatment. Directions. Each set of lettered headings below is followed by a list of numbered words or phrases. For each numbered word or phrase, select A. If the item is associated with cognitive behavioral therapy only. B. if the item is associated with psychodynamic therapy only. C. If the item is associated with both cognitive behavioral therapy and psychodynamic therapy. D. If the item is associated with neither cognitive behavioral therapy nor psychodynamic therapy. Produces 80 to 90% panic-free status in panic disorder within at least 6 months of treatment. The answer is A. Associated with cognitive behavioral therapy only. May be nearly twice as effective in the treatment of social phobia as a more educational supportive approach. The answer is A. Associated with cognitive behavioral therapy only. Goals are more ambitious and require more time to achieve. The answer is B. Associated with psychodynamic therapy only. Combining treatment with medication may be superior to either treatment alone. The answer is C. Associated with both cognitive behavioral therapy and psychodynamic therapy. Some studies have shown that cognitive behavioral treatment of panic disorder produces 80 to 90% panic-free status within 6 months of treatment. The most thoroughly studied form of therapy for social phobia is a group therapy consisting of training, exposure and role-playing. Psychodynamic psychotherapy is based on the concept that symptoms result from mental processes that may be outside of the patient's conscious awareness. Outcome research is somewhat limited, but one study showed that cognitive behavioral group therapy was nearly twice as effective as standard educational supportive psychotherapy. Directions. Each group of questions below consists of lettered headings followed by a list of numbered phrases or statements. For each numbered phrase or statement, select the one lettered heading that is most associated with it. Each lettered heading may be selected once, more than once, or not at all. A. Panic disorder. B. Generalized social phobia. C. Post-traumatic stress disorder. D. Generalized anxiety disorder. E. Acute stress disorder. Is associated with depersonalization. The answer is E. Acute stress disorder. Must include at least 2 spontaneous panic attacks. The answer is A. Panic disorder. Symptoms must persist at least 1 month after the trauma. The answer is C. Post-traumatic stress disorder. Must include 3 somatic or cognitive symptoms associated with worry. The answer is D. Generalized anxiety disorder. Difficult to distinguish from avoidant personality disorder. The answer is B. Generalized social phobia. A panic attack is defined as an episode of abrupt intense fear accompanied by at least 4 autonomic or cognitive symptoms. Post-traumatic stress disorder, PTSD, is a condition marked by the development of symptoms after exposure to traumatic life events, for example, war, natural disaster. Directions. Each group of questions below consists of lettered headings followed by a list of numbered phrases or statements. For each numbered phrase or statement, select the one lettered heading that is most associated with it. Each lettered heading may be selected once, more than once, or not at all. A. Imaginal exposure. B. Interceptive exposure. C. In vivo exposure. D. Systematic desensitization. A patient is presented with photographs of snakes while practicing various relaxation techniques to overcome fear. Gradually, he practices relaxation while in the presence of live snakes. The answer is D. Systematic desensitization. A patient with OCD attempts to use public telephones and doorknobs while intentionally refraining from washing her hands afterward. The answer is C. In vivo exposure. A patient is asked to imagine his wartime experiences as vividly as possible, to confront his memory of the traumatic events. The answer is A. Imaginal exposure. A patient breathes through a thin straw to produce the sensation of not getting enough air. This activity produces a similar sensation to the distressing feeling of getting on an airplane. The answer is B. Interceptive exposure. Exposure therapy involves intentionally confronting feared, but otherwise not dangerous, objects, situations, thoughts, memories, and physical sensations. Systematic desensitization was an effective treatment for some anxiety disorders, but has generally fallen out of use among researchers and cognitive behavioral therapists. Directions. Each group of questions below consists of lettered headings followed by a list of numbered phrases or statements. For each numbered phrase or statement, select the one lettered heading that is most associated with it. Each lettered heading may be selected once, more than once, or not at all. A. Acrophobia. B. Aleurophobia. C. Cynophobia. D. Misophobia. E. Xenophobia. Fear of dirt and germs. The answer is D. Misophobia. Fear of heights. The answer is A. Acrophobia. Fear of strangers. The answer is E. Xenophobia. Fear of dogs. The answer is C. Cynophobia. Fear of cats. The answer is B. Aleurophobia.